Good morning. This is your pharmacist, Dr. Ernestine Watson from Everybody's Pharmacy in Crossroads. This morning, I'd just like to talk to you a little bit about some of the things that are happening in medication therapy for you that affects you right now. The role of the pharmacist is beyond, of course, just dispensing. We are here to ensure that the medications that you are taking, you are getting the best benefit from it. And so medication therapy management is actually how the pharmacist intervenes in your therapy to ensure that you are getting your desired effects. For this Monday, I'd like to talk a little about some of the issues that are happening. We have the issue of the dengue and the fever that is associated with it and some of the other effects. And just a little reminder for all of us is that to treat dengue, the best thing to treat dengue is simply to take your acetaminophen. There are many different brands of acetaminophen, but please do not take aspirin or any drug that has an NSAID, which is, for example, ibuprofen. Should not be taken if you suspect that fever is associated with dengue. Of course, you ensure that you take the temperature, especially for the children. Many cases we have seen coming into the pharmacy with prescriptions for fever, or parents complaining of the child having a fever. So please, you can take the acetaminophen or any of the related brands, but don't give the children aspirin. Another thing that I'd like to talk about is the effect of the vaping that we have been hearing so much around all over the world. And in fact, it has been mentioned in Jamaica. I'd like to say to all of us and to all parents especially, for teenagers who may be thinking about getting involved, stay away from vaping. It is not good for you, and the symptoms are so similar to other respiratory illnesses that it is very difficult. And there have been many cases of death associated with this this practice. The other thing that I'd like to say shortly is that we are into mental health awareness, and as pharmacists we see a lot of patients, and one of the things is that patients have to take a lot of medications. So as pharmacists we have a big role to play, and we encourage you to come in and speak with us. We are able to help you through some of the side effects that you may see when you start taking, or a loved one starts taking these medications. So don't be afraid to come in. We are here for you. Come in, speak with your pharmacist. You have a question, feel free, ask your pharmacist, and I'll be back with you with more motivations and more updates on medication therapy and how you can get the best from your drug therapy. Bye.